Growing concern this morning over the Zika virus here in the U.S. Florida's governor has declared a health emergency to try to stop its spread. Eyewitness News reporter Jan Carabeo joining me now with the developments. And this was one thing last week when we thought, oh, it's other countries not going to affect us, but now it's a real concern.
Almost 50 cases now in the U.S.
Wow.
And it's a real concern, so much so that Florida now has at least 9 confirmed cases of the Zika virus. These are all patients infected overseas, but the concern is now growing to that these patients could now infect U.S. mosquitoes. So the governor there has issued a health emergency in 4 counties.
The number of Zika cases is now growing in the U.S. Health departments in 12 states and Washington, D.C. have reported at least 48 cases. So far, each patient has been infected overseas, except one sexually transmitted case in Texas. In Florida, an emergency health declaration has cleared the way for more spraying of mosquitoes. CBS News chief medical correspondent Dr. John LaPook spoke with anchor Scott Pelley from Brazil recently, where the virus is the worst. He explains Florida's action.
Scott, I think it's an attempt to stay ahead of the problem by lowering the odds that Zika virus will enter the local mosquito population in Florida. Now remember, the same species of mosquito that houses the Zika virus down here in Brazil also exists in Florida. So far, there's no evidence that those mosquitoes have the Zika virus.
But he says the virus could spread like this. An infected mosquito bites someone, say, in Brazil. The virus stays in the person's bloodstream for about a week. That person then comes to the U.S. An uninfected mosquito bites him, gets the virus, then bites someone else. Now the virus is in a U.S. mosquito.
What's the likelihood that there will be a mosquito-borne outbreak in the United States?
Scott, I think it is very, very likely that eventually Zika will make its way into local mosquitoes, probably in the southern part of the United States first. But all the health officials I've spoken to think it's very unlikely you'll have a big outbreak on the scale of something, say, in Brazil.
Now, Zika is linked to birth defects, and pregnant women have been advised to avoid travel to countries where the virus is spreading. The CDC is also advising pregnant women to protect themselves if their male sexual partner has traveled to a country where Zika is spreading.
Now, we know about Florida and the states. Is there anything that can be done to really slow the spread of this virus?
So we're really learning from what Brazil is doing right now because they're hardest hit. What you're seeing down there and what you will likely see being done in the U.S. as well is increased spraying, getting rid of those breeding grounds, that standing water, and really just public education for people about using the spray and covering up. And we will also talk more in our next hour about when a possible vaccine could be available.
People are clamoring for that already. Jan, thank you.